Welcome to this video. So in today's video, because a case scenario, I'm going to learn a related anatomy of it. Okay, so in today's video, a 23-year-old male reports that during a game of hoops, which is basketball, he tripped while driving the ball to the basket and fell on his outstretched right hand. So this is the catch here. He fell on his outstretched right hand, okay, with the palm down. 2 days later, he found his anatomist father. So his father was an anatomy teacher, and related that his right wrist was painful. Later that day, he visited the father, who noted that the wrist was slightly swollen and tender. So the swelling and tenderness are key signs of fracture, but without deformity. So let me move myself from there. He instructed his son to extend the right thumb, thereby accentuating the anatomical snuff box. So if you have seen my previous video, you will know about the anatomy of anatomical snuff box. So which is extremely tender to deep palpation. So as we discussed earlier, anatomical snuff box tenderness means it is referred to as the box sign, which in turn implies that this is again a case of wrist fracture or scaphoid fracture. So it is a case of scaphoid fracture. So let's learn the anatomy related to wrist joint, scaphoid and other carpal bones. Also we will discuss a little bit about Colles and Smith fracture. Okay, wait a second. Okay, so as you can see from this, here. Okay, this is the wrist joint. Okay, so as you can see clearly from this image, the ulnar bone, this is the ulnar bone, and this is the radial bone, radius. So the ulnar bone is not involved in the formation of the wrist joint. So as you can clearly see here, there is no connection between ulna and the carpal bones. So as such, there is no connection. So the ulna does not take place in the formation of wrist joint. This is very important. And the wrist joint is formed between the distal end of the radius and the proximal set of the carpal bones. Okay, so this is the wrist joint exactly. Okay, fine. So after knowing this important clinical fact, as you can see in front of you, these are the 8 carpal bones, and there's a famous mnemonic to remember them, that is, she looks too pretty, try to catch her. So many of them will not forget this sentence, but the most important thing which you have to remember is this mnemonic starts from lateral to medial side. From radial to ulnar side, first referring to the proximal bones and then the distal bones. That is also similarly from the radial to the ulnar side. So now as you can see here, this red one is the scaphoid bone, this is lunate bone, this yellow thing is triquetrum, this is pisiform, a hanging bone which is pisiform. Then when you come to the distal segment of bones, this is trapezium, trapezoid, this is capitate, and this is hamate. Okay, so she looks too pretty, try to catch her. Okay, fine. So these are the various carpal bones and the mnemonic to remember them. Now let's discuss. Okay friends, in this video we have discussed about the anatomy of wrist joint, carpal bones and the mnemonic for the carpal bones. So in our next video we will discuss the related anatomy for it. Thank you.